Hi, my name is Mackenzie and I'm a student physical therapist from Methodist University. Today I want to talk a little bit about urinary dysfunction, bowel dysfunction, and strategies that we can use to help with urinary incontinence and bowel incontinence. So the first thing that I want to talk about today is the urinary system and what may cause urinary incontinence and the strategies that we have that can help with incontinence. So the first thing I want to talk about are the urinary organs. So we have our kidneys that go down to the ureters, and then the ureters, there's two of them, they connect to the bladder here. And the bladder goes to the urethra, and then the urethra helps urine pass out of the body. The bladder is a really important structure in the urinary system. It has the ability to store urine, and it helps with evacuation of urine. There is a smooth muscle called the detrusor that really helps with, when it's relaxing, we are not passing urine, but when it is contracting, it helps pass urine out of the body. When the detrusor contracts, the pelvic floor musculature, which I have here, must relax. So if someone has very hypertonic or pelvic floor musculature that's always on and always contracting, it can be very hard to pass urine because that pelvic floor musculature has to be able to relax to be able to pass the urine. Sensation in the bladder can also be increased, reduced, or completely absent, which can also cause some urinary incontinence. The bladder has sympathetic nervous system input, which helps with storage, and then it has parasympathetic nervous system has a role with emptying. And then our peripheral nervous system helps with voluntary control. So there are a couple of reasons that someone might have incontinence or you might have incontinence, and that could be that the urethra doesn't close. So that means this part here has like a little hole in the bottom. If it cannot close, urine may constantly leak out. And then there might also be the urethra may relax and just continuously let urine out. And then here, with our pelvic floor musculature, we have several muscles that help with compressing the urethra to keep it closed. So here we have the levator ani, and these muscles help when we want to push or when they can help to lift up the urethra. In this layer of muscles, we have the compressor urethrae and the urethrovaginal sphincter. These muscles help to close around the urethra here. So, for example, the urethra would pass through here. These muscles help to keep that closed. And then here we have the ischiocavernosus and bulbocavernosus. Those also help with controlling urine. I also want to talk about the types of urinary incontinence. So we have stress urinary incontinence, which is really like if we're leaking urine when we're coughing, sneezing, jumping on a trampoline, working out, that kind of thing. And then there is also urge urinary incontinence, which is associated just with like, oh, I really have to go to the bathroom, and you might just have leakage during that time. There's also like functional urinary incontinence, so that would be like, oh, I walked to the bathroom, but I walk really slow and it just kind of happens before I can get to the bathroom. Or if you have difficulty with like snaps or buttons. Some specific techniques that we have for stress urinary incontinence is called a knack technique. So when you feel the urge to cough or sneeze, you can contract the pelvic floor. So that would be like picking up a blueberry with your vagina or trying to really hold your urethra closed so that you don't pee before you cough or sneeze. For urge urinary incontinence, when you feel the urge to go, we want you to stop, take a deep breath. So contract your pelvic floor 3 to 5 times. So that'd be a quick flick. It's like 1, 2, 3, 4, 5. Take another deep breath and assess, do I still need to use the restroom or am I good to go? If you do need to use the restroom, just walk calmly to the bathroom and then you can go. Another really important part of urinary incontinence are bladder irritants. So I have here a board that I've drawn all the bladder irritants on. So we have coffee and tea, acidic, which is like lemon flavored things, spicy food or curry, tomato-based products, dairy products, chocolate, which really stinks, artificial flavors, colorings, and sweeteners, cold remedies, and alcohol. And one thing is that we don't want you to completely cut these out of your life. What we want you to do is sandwich them. So we want you to have water with no type of like additives to it. So no drops of Mio, no Propel, anything like that. Just plain water out of the Brita filter or the spigot, whichever you prefer. And then you can sandwich your irritant between them. So if you want a piece of chocolate, have a piece of chocolate, but have it in between some water. And then the other side of the sandwich is water again. So those are some of the urinary incontinence tips and tricks that we have. Now I want to move over to bowel dysfunction. So with the bowel, we have internal anal sphincter and external anal sphincter. The internal anal sphincter is under involuntary control, meaning that we have no control over that. And it is run by the parasympathetic system, and it has 80% of our resting tone. Next, we have our external anal sphincter. So that is here in one of the layers of the musculature, and that is under voluntary control. So we are able to open and close the anus whenever we want to, and that is through the sympathetic nervous system, and it provides 20% of our resting tone. And then here we have the levator ani musculature. So we have iliococcygeus, pubococcygeus, and puborectalis. These provide a U-shaped sling, and they're part of the sphincter complex, and they play a big role in fecal incontinence. This has 70% type 1, which is like fatigue resistant. So they're slow twitch fibers, and they just kind of constantly have a little bit of tone to them so that we are not having fecal incontinence throughout the day. 30% of this is that fast twitch fiber, which helps to really close down when we need it to, and those are just kind of quick. So constipation is a big problem with bowel dysfunction, and if someone has like a pelvic aortic prolapse or incomplete relaxation of that puborectalis muscle here, that can really cause some constipation issues. There are a couple strategies we have for that. There's the orthocolic reflex that can help us with bowel movements. So that is when you first wake up, you stretch, you walk around, and you get the bowel moving that way. And then we also have the gastrocolic reflex, which helps when we eat a meal, our gastrointestinal system starts to be mobile and provide motility following a meal. We can also do some anal sphincter exercises, which is this muscle here, to also help with fecal incontinence. Some other management strategies for bowel incontinence is fiber intake. So if you weigh 150 pounds, then you want to have half of your body weight, or half a gram per kilogram of your body weight. Also, another important thing is your fluid recommendations. So if the patient weighs 100 pounds and you want half your body weight in ounces, that would be 50 ounces of water a day. And then the fluid recommendation is 2/3 water, 1/3 irritant. So again, that comes back in with our sandwich technique. Other techniques we can have are time toileting techniques. So we want you to attempt a bowel movement twice a day. 30 minutes after a meal, you can strain a little bit, but only keep that between a 5 to 7 out of 10 strain. No more than 5 minutes. And then you can also use vocalizations such as zzz, shh, and grr while you're trying to pass a bowel movement. You can also do a bowel massage, so that would be in a clockwise direction. And then the last thing I have to offer is toileting position. So here I have my squatty potty, and you can use a squatty potty to help with the anorectal angle while you're using the restroom. So if you don't have a squatty potty, you can use like a trash can tipped over or anything like that. If you have any questions, feel free to reach back out. If not, thank you and hope these help.